So, we've been talking about the abject misuse of antibiotics in India. In the first of this two-part series, we started by asking some of you about your awareness and usage of these medicines.
Recently, I got ear infection, so at that time I used antibiotic.
Sometimes I don't know what these medicines do, so I just take them on my own as well.
One antibiotic at the top of my mind all the time is azithromycin or any of those mycin ones.
Norfloxacin, Tenacid.
Azithromycin, Augmentin.
They're mostly used for infections. Could be viral, could be bacterial.
I've at least had 7 of them.
So I've been very ill throughout the year. I think 7 or 8 courses so far.
When I played these responses to my colleague and ET's pharma leader Vikas Dandekar, his response was,
Anirban, this is unbelievable. Each of the reactions actually go to show how badly we need to have enough controls on antibiotics. Quite unknowingly, it has become a very, very big problem because we have seen people actually going over the counter getting azithromycin. Sometimes I have even seen Augmentin being just given without any prescription. So that's a much more deeper problem to have.
So this is a big problem. And to get deeper into it, we spoke to a prominent medical practitioner, Dr. Vinny Kantru of Apollo Indraprastha Hospitals, one of the most vocal critics of this problem.
The problem is universal. It's not only present in India. These antimicrobials are abused in cities. Antimicrobials are prescribed more than they should be in smaller cities, as well as for infections where we may not be needing any kind of antimicrobials to be prescribed.
And we spoke to Manish Paul from Orchid Pharma to get the industry side of the story.
The global R&D work on AMR has shown that by 2050, the death rate is going to be significantly higher. The bugs decide to take over us.
Right.
Those numbers become fictitious again. So that is the threat again why everyone is scared to invest into antibiotic R&D because the future is unpredictable.
That was part 1. In today's episode, we deal with the global contours of this problem, its expanse, the efforts being made to curb it, and the role India can play in this. With Vikas, of course, and another very special guest. Listen in to the concluding part of this important deep dive, which we are dropping during the World AMR Awareness Week. It's Tuesday, the 19th of November. I'm your host, Anirban Chaudhary. This is The Morning Brief. So, I started by asking Vikas about the global efforts being made to deal with this problem.
That's a fantastic question, Anirban. Basically, the response has been kind of in silos. The problem has been around for decades, but there hasn't been a concerted international response. We have seen small efforts made by different groups. WHO itself has been talking about it, about guidelines, and it has actually spoken about something called AWARE. In fact, here's more from Dr. Tedros Ghebreyesus of WHO.
Every year, AMR contributes to nearly 5 million deaths, and without urgent action, that number will only grow. Stopping AMR is a shared responsibility. Let's work together to protect the medicines that protect us.
Basically, this is, again, goes to show it's a problem mostly of the low and middle income countries groups. So it hasn't found so much of interest from global companies. Research has been slow and not so much of investments have come in. Companies from India are actually trying their best, a couple of them, like we have seen Orchid, Wokhard, even Bugworks. They are trying their best to get some medicines out. But obviously, the problem is far, far bigger than, we can even imagine. United Nations General Assembly actually came up with a declaration in September, which was a very clear statement of actions to be taken by countries, execution, how, national level action plans need to be mooted.
At the 79th United Nations General Assembly, new guidelines and targets were established to reduce human deaths caused by antimicrobial resistance by 10% per annum by 2030. The declaration calls for sustainable national financing, in addition to $100 million in catalytic funding to help achieve the target.
So that is something that we have actually seen as a very serious move. But that has come just recently. So we'll have to go and see exactly how all of this pans out.
Right, right. And that is a very grim picture, Vikas. And just like in the last episode, let's go over to a conversation that you had with Dr. Manika Balasegaram, Executive Director at Global Antibiotic R&D Partnership. Dr. Balasegaram has done extensive work in the field with the issue of AMR. He is what you would call a global health leader. Why don't we just go over to that?
Yes. Thank you so much, Dr. Manika Balasegaram, for joining us for this very important podcast.
Thank you very much for having me.
So, as someone spearheading this global antibiotic research and development partnership across the world, what has been your experience so far?
I think, we're now seeing a fairly serious situation with antimicrobial resistance. Unfortunately, what has happened over the last 40, 50 years is the speed of discovery of new classes of antibiotics has slowed down. While at the same time, we're seeing big increase in global population, big increase in consumption of antimicrobials. In fact, we are currently in the situation where we are seeing a significant number of people now dying from infections associated with antimicrobial resistance. This is now in the multiple millions from recent studies that have been published even this year alone.
So there is a global push that's been given. In September, there was this very clear political statement that was made between different world health agencies on ways to kind of see how we can bring down at least by 10% a year the estimated deaths by 2030. The declaration, is seen as a very powerful statement against this war against AMRs. How do you think countries can actually, get into the execution mode and see what exactly needs to be done?
So what you're referring to is the United Nations High-Level Panel on Antimicrobial Resistance and a declaration that's come out of it because, we are in a situation today where there's probably around 5 million associated deaths from antimicrobial resistance. So this is quite serious. There are also specific things that are important. For instance, while antimicrobial resistance is a problem, we know that actually more people are dying from a lack of access to existing antibiotics than from antimicrobial resistance. So one of the things that is very important that we need to understand is we need to improve access to life-saving antimicrobials in order to reduce mortality from these serious bacterial infections that occur. The other thing that we know we need to do is also invest in prevention. So it can also include vaccination as a way of reducing the infectious disease burden and actually reducing the use of But the third point that I would like to raise is that we need new and improved treatments. And these treatments can either be how we better use existing antimicrobials, but it also needs to include innovation, so development of new treatments and new classes of antimicrobials that will address this growing problem.
Right. Some very interesting points that came up from this, Doctor. You mentioned about lack of access to antibiotics more than anything else. Now, in India, we have another situation where antibiotics are really available across the counter. And that also has been seen as one of the big reasons why we have reached this situation of AMRs, of superbugs really dominating. A lot of hospitals are having that big problem. Do you think it's a problem that needs to be addressed very differently in a populous country like India?
Well, first of all, let me address that point that you've raised. That is true that there's probably overuse of a lot of antimicrobial agents. There's also probably in the past, there has been some use of combining certain agents in an irrational way, i.e. without evidence to show how you would use these drugs. That is something that the Indian Drug Regulatory Authority has started to look at now for some time, to actually address this issue, as well as the respective ministries of health in different states. I think, however, that we need to maybe see this in a different way. There is significant opportunity for India to address this issue based on its own strengths, And I think this opportunity extends beyond what India can do at a national level. It extends what India can contribute at a global level. And this is exactly why organizations like ourselves in GuardP are actually working with partners in India and actually investing in working in partners in India. And I think this is quite important because the antimicrobial resistance has been kind of haunted by the specter of kind of a background of market failure as well as a public health failure. And the market failure has led to a decline in research and development of new improved treatments for antimicrobial resistance. But we should remember that a large country like India with a growing economy in its own right represents a critical mass. Last but not least, India has a track record, for research, development, production, supply of affordable vaccines and medicines. And this is a track record that we now need to tap into to address this global emerging problem. So I think you need to, shift your mindset a little bit to say, this is a problem everywhere in the world, not just in India. But India has also huge capacity and huge, I think, skills and resources to contribute to addressing this problem globally.
Basically, a point that actually was in one of my questions was about, how doing antibiotics research hasn't been great, profitable proposition for pharma companies. So, you have very short patent life because it takes a long time to do the clinical development side. The ROI is small because, it's a infection which comes and goes in 10-15 days. And so from the point of view of the pharma companies, it probably has become less attractive. So as GuardP, will there be something that you will be able to provide? I see you having collaborations with Indian companies like Origin, Orchid, Bugworks. So
I think there's a couple of things that need to be done, right? I think the first is an obvious one. We need to have more incentives, okay? So companies, wherever they are in the world, they need incentives. So funding by governments and other actors to actually support antimicrobial research and development. And this is something an organization like GuardP brings. We work with governments around the world. We are largely funded by governments. And we think about how to develop a strategy to not just look at the best way to develop these drugs, but how to ensure that they are accessible at the end. So things like subscription schemes have been talked about. Can governments introduce a subscription for a new antibiotic that is not linked to the volume of the antibiotic use? But I think there's a third aspect, which I think is often forgotten, is maybe to think about a different model of how we develop these drugs. So especially if we're using more public financing and non-profit financing. I think that we can also look at different pathways of how we develop the drug and also look at where we commercialize these drugs first. So the typical model is we put in a lot of money, we do the research and development, we bring it to market in a high-income country like the US. I think this is one of the things as GuardP that we're doing. We're creating networks of partnerships between biotech companies, manufacturing companies, for instance, that are based in India, and then looking at how we can more rapidly bring some of these treatments to higher burden countries where, the treatments are more relevant from a public health point of view, but potentially there's a different kind of market that can be available. And this potentially could create more of a critical mass to make these treatments more, I would say, sustainable when they're introduced. And that's why we've gone out and partnered with Origin, which is part of the Dr. Reddy's group, and Orchid Pharmaceutical, which is kind of a very well-established old antibiotic company. It's been around for some time, but has some of these capacity and skills. And we also want to kind of bring in some investment to enhance that, but utilize that existing capacity to look at how we can look at lower cost manufacturing globally. And that, of course, increases margins for companies that have maybe a different view of what they would see as profitability for a new treatment that they can bring on, particularly if some of the research and development has been de-risked already.
Doctor, one more question which comes to mind is from a doctor, So if you actually go, and this is a very practical question.
Sure.
If a doctor is actually seeing a patient who's got a cough, right? Now, for the doctor, it's important to give the patient a medicine, which works. Sometimes it probably is a viral, but an antibiotic is given. Now, the point that the doctor was actually trying to make is that, I cannot send the patient for a simple cough to go and do a culture test, because the culture test, even the panels and all are so expensive. I mean, in a resource-constrained setting like India, you will find it very difficult for the doctors to do a test-based treatment analysis.
Yeah.
How does one approach that problem? Because more often than not, antibiotics are just given probably completely on guesswork.
Yeah, you're absolutely right. Sometimes you have to make some very difficult decisions. But increasingly, there are tools and algorithms that are put together to help guide clinicians on how they can use these antimicrobials, including in the absence of diagnostic tools, or where diagnostic tools are quite limited. And this is where, I think the issue around training and support of clinical staff, and even do it for doctors as well. I mean, if I look back in my own medical education and think, how much was I really trained on antimicrobial stewardship and use, and these kind of, strong clinical algorithms to really make me reflect on how I was prescribing antibiotics? I would be very honest and tell you, very limited training. Right. And I was trained in the UK, and at that time, it was admittedly 30 years ago. I hope things have changed, but it's just a reflection to tell you that across the world, this is not a problem unique to India. This is a problem that we're confronted with across the world, including in high-income settings and low-middle-income settings as well. I also think there needs to be much more research in this area to actually develop better, cheaper diagnostic tools. Now, if you looked at the whole diagnostic revolution that happened in COVID, when the huge investment went to that so you could develop rapid tests for COVID, it's a scientific, technological question to see whether we can actually do that in AMR. But I do think there needs to be much more investment so that we can actually move to a different way of working, in terms of diagnostics. That requires significant investment globally.
Doctor, you must be scanning the entire globe on what exactly is happening in research labs. And from what we see from the Indian labs is the backbone of the two products that we have seen. One already getting an approval from the US FDA, the Orchid drug, and also the next one from Walker. Yeah. The backbone still remains cefepime. I mean, combined with another potent antibiotic. And when a situation like carbapenem has happened, is not working, colistin is not working, again, a very lethal drug also.
Right. Yeah.
How do you see the next level of pipeline emerging?
Well, I think, there is a lot of investment now to try to go into kind of early research. That will take time to materialize, okay? So what we will need to rely on is diversity in antimicrobial use. So we need a diverse range of tools to address different types of resistance that we're seeing emerging. However, what we also need are new classes of drugs. But this is exactly why GARDP is partnering with Bugworks, because we believe it is very important to also invest in different newer approaches that can hit some of these multi-drug resistant strains that are now emerging, and approaches that are also different. So I think this is something that obviously is well understood, I think, in the research community in antimicrobial resistance. There is, more efforts being made on early discovery and also what we call early translation research and development. But it will take time before some of these efforts will materialize. And I would say that globally, we need much more resources in research and development, both in early and late stage.
Right. One last question, and a quick one. What's the latest in terms of the interest from global companies? I have seen Shionogi doing quite a number of deals. Pfizer's Zevicefta is, I think, in generic now. But beyond just a couple of these names, I do not see big pharma getting excited the way it does in neuroscience or oncology.
Yeah, I think one shouldn't be surprised with that. I mean, there is still a group of companies that are implicated. You've mentioned that. And I think they will hopefully continue to stay involved in this space. Shionogi, for instance, has a very long history of involvement in infectious diseases that goes back a very long time. So, I think some of these companies will stay. But I would add that it's not an easy environment, and it's hard for the companies to justify to their boards, their investors, their shareholders on why they would put, X million dollars on an antibiotic versus X million dollars in another therapeutic area where there's a much higher return on investment. That's the system we live in, whether you like it or not. So I think this is an issue now for policymakers and governments to address, and now to look at the type of interventions that will be very cost effective in delivering the outcomes we need from a societal point of view. Look at the opportunities that exist within the country to address the issue nationally and important globally, because this is a global problem. These problems pass from countries to countries, okay? So there has to be some element of global effort. You can't just deal with it on your own. And some issues like research and development are very, very expensive. So actually pooling the way of how you address this makes a lot of sense. But at a national level, I would really reiterate there is a huge opportunity to look at some of these kind of key unique skills and opportunities and strengths that India has and invest in that, so that we
Sure.
can address this problem. And it's an investment in your own capacity, so it makes sense, if you see what I mean. But that will have a big knock-on effect globally on how we can address this problem.
So Vikas, just like last time, your takeaways and final comments for this episode on this issue.
Yeah, it was such an interesting conversation. I came out learning so much from Dr. Manika's views. One of the crucial points he made was about how Indian companies are trying their best to change the picture. And he is actually likely to travel to India to do some kind of a government level partnerships. So finally, I feel something is definitely moving against a very low-key program and something that has been ignored. But now that the problem is actually becoming so grave and there is no real hope beyond a couple of research projects, things hopefully will become a lot better in terms of interest from scientists and global companies and, of course, global agencies to push this case. So it was a very interesting discussion, takes us ahead in terms of what progress needs to be made.
And on that note, we'll wind up our conversation. Thank you so much, Vikas. It was a pleasure, as always, to have you.
Thank you, Anirban. This is a very crucial subject. It was great to participate here. Thank you for the opportunity.
That's it for today. You were listening to this episode on The Morning Brief. It was produced by me, Anirban Chaudhary, and Surohini Jain, sound designed by Indranil Bhattacharjee. The Morning Brief drops every Tuesday, Thursday, and Friday on a listening platform of your choice. Do also listen to ET Wealth and Beyond, our special series in collaboration with the Bombay Stock Exchange. In the next one, that's the 6th episode, ET's markets editor Nishant Vasudevan talks to IIT Madras professor and finance guru M. Pattabhiraman and another expert, Ravi Saraugi. The conversation is on how to invest for and post-retirement. Keep listening to ET Podcasts. This is your host Anirban Chaudhary signing off. Have a good week.